Hi there, and thanks for joining us. I'm Emily Irwin. Community Regional Medical Center is the first and only hospital in Central California to receive a Center of Excellence designation in neuroscience. From cutting-edge diagnostic tools to treating a wide range of neurological conditions, patients don't have to travel outside of the valley to receive the treatment they need if they've suffered an illness or injury to their brain or spine or a stroke.
Hi, Ms. Woods. How are things going?
When Dr. Taggard first met now 23-year-old Chyna Woods in 2019, she desperately needed help.
I had extremely excruciating back pain. I couldn't sit down, or I couldn't lay down or sit down for long periods of time. I couldn't even be in a car for longer than 10 minutes.
She started to develop numbness in her legs, numbness in her chest wall, which was obviously very concerning to her.
Dr. Taggard, a neurosurgeon with Community Health Partners, says Chyna's pain was between her shoulder blades. He ordered her to have a biopsy.
She was found to have a large tumor that was had invaded into her spine, causing compression of her spinal cord, which was the cause of the numbness, but it was also located in her chest cavity and behind her heart.
Chyna had a paraganglioma, a very rare type of neuroendocrine tumor. Dr. Taggard says the large tumor explained her excruciating pain.
I think she probably developed the tumor just in front of the vertebral body, and as it grew, it became very locally aggressive and chewed through the side hole and through the vertebral body and started to cause compression of her spinal cord.
The National Cancer Institute says scientists have found paragangliomas form because of a genetic mutation. Dr. Taggard suggested Chyna undergo surgery.
I thought the best thing for her was a staged procedure, which means the first stage was through her back, and we got the tumor away from her spinal cord, did a fusion with the screws and rods above the level of the tumor and where it had invaded her spine.
Once the tumor was removed from the back of her spine,
and then we were able to coordinate with thoracic or cardiothoracic surgery for to go through her chest wall, then go through her chest cavity and get the rest of the tumor out that was in front of her spine.
Dr. Taggard worked with Dr. Shamsuddin Khwaja, board-certified cardiothoracic surgeon at community medical centers, so Chyna could receive multi-specialty care under the same roof.
I don't think you want a brain surgeon or a spine surgeon cracking your chest open, right? And likewise, you don't want a cardiothoracic surgeon trying to dig some tumor out of your spine, right? But when we do it together, she's had a great outcome. She's not had any complications.
Dr. Taggard says he and Dr. Khwaja successfully removed the entire tumor, and today, Chyna is healing and thriving with little to no back pain.
I like to thank him. I feel that he's a very great doctor. Amazing even.
She's been a joy to take care of, has always had the best attitude, and is always very positive and optimistic about what's going to happen next.